get, getting involved in that, in creating that enabling environment. Very important and very clear. But the entrepreneur who sticks his neck out in the health sector must get support in terms of training. He cannot be backward where his peers they have access to cutting-edge information. He also must have access to such training. He must understand the fundamentals of setting up a business. We weren't trained in medical school how to set up a clinic and make it thrive as an owner manager. We weren't trained to partner with the big boys. We weren't trained to collaborate. We weren't trained to integrate ourselves in a supply chain. We weren't trained to understand that the pain points in our sector are actually the opportunities for us to create cutting-edge, innovation and make money from it. They also need mentors. One of the things we've incorporated into the program, we have over 700 mentors who are unleashing and unloading their experience onto entrepreneurs. We need such in the health sector. We have mentors from all over, and we have some big boys also on we just signed, agreed a partnership with Microsoft yesterday evening. We've agreed a partnership with PharmAccess. We're agreeing a partnership. I'm having a meeting tomorrow with Coca-Cola. These are all organizations that are interested in supporting healthcare, but they're also interested in supporting entrepreneurship. We think that when you incorporate these in an online platform with seed capital, with access to meeting together, and then forming a network that promotes and protects the entrepreneurs, then you're on to a winning deal.
Is there anybody else in the audience that has a specific package that has been designed for the healthcare sector with direct application of the technology?
My name is Chugo. I'm representing my Slope, Nigeria. I work in Abuja. So let me just be quick. My Stoops is it's a global organization, and we are a country office. And we're one of our main, just the background, what we do is provide modern reproductive health services to Nigerian women and also men, because we're gender sensitive. So we do this by providing a variety of FP services, modern technology, training providers as well to provide family planning services within the private sector. But also we have programs that cross-cut between public sector. But in terms of health, in technology, mobile technology, what we've done in the past 1 year, we have set up a call center. It's called Mali Connect. This call center is mainly to break barriers in terms of quality health information. So you have, and it's also a strategy for reaching the youth and the poor as well. So we have people calling, and it's toll-free, the lines are toll-free. How did we get people to know about this? It was through, of course, social media, Facebook, Instagram, Twitter. So we have people who call in. Now this call center helps us promote confidentiality for people, for young adults, young buds who don't want to access service by coming to the health facility. So we have a lot of them calling, and the tolls have been increasing because they don't charge them money, so they call. And we have call agents who provide very up-to-date information on healthcare, on what they need, and refer them to where they would access service without any barriers, because we have a network of, we have our social franchise network with providers trained on providing these services. So our Mari Connect is really like cutting-edge technology in terms of mobile healthcare. When Intel said that, and particularly with the Tony Elumelu Foundation, we have one of your entrepreneurs who reached out to us trying to learn or study how we set up our call center. So I think that's one innovation that has worked really well.
My name is Esme Anyao, and I'm the Managing Director and Chief Healthcare Strategist for Effort Services Limited. What we do is we realize that, like Ms. Abimbola mentioned, there's a lot of people that have already created technologies that can be applied to healthcare. So what we've done is we've sort of researched around the world with regions that have similar constraints from an infrastructure perspective as Nigeria. We know now healthcare, we have to really take a leapfrog ahead and not introduce antiquated systems, but actually systems that are being used around the world. So when we find these organizations, technology developers, one of the biggest fears is coming to Nigeria to do business. It doesn't help when you read World Economic Forum, some of these reports, Nigeria continues to be the hardest place to do business. So what we've done is build that trust with them. They pretty much outsource all of their IT installations, support, marketing, and we work very closely with them to really bring those technologies into the region. One of the good ones that we have right now that I'm very excited is around the diagnostic space. Healthcare is huge. We can't do it all, but we really find opportunities where there's huge gaps. There's about 1 radiologist to about 400,000 patients in Nigeria, compared to 1 to 10,000 in the US. So what we've done is we're able to monitor and also send studies from the modalities by simply connecting to their network. We also know network infrastructure is an issue. So we're able to do this using just the same data as your 3G mobile phones. So where there might be low bandwidth, high latency issues, this takes care of that. We're able to send those images in less than 3 minutes, depending on the size of the study, but we're also able to create access to radiologists all over the world. So a radiologist can pretty much run their facility, or a hospital can run their facility 24/7, having more care for the patients, providing more access. And the patients won't even know that their reports are being read by radiologists in the US, UK, or India. So these are the type of things that we've realized, and there's a lot of developers out there in the world that would love to come to Nigeria. We have the market, but then how do you create that trust, and how do you really have people on ground? And so this is what my organization does in Efforts, and this is something that I feel has been very, very great in the environment, and we're continuing to work with more partners and introducing more technologies in the region.
Excellent, thank you very much.
Good afternoon, my name is Alex Azuke and I represent Internet Experts. We are a software solution company and we do health information systems that help hospitals automate their business process. I'd like to key into what a lot of the panelists have talked about. The ultimate, in our philosophy, the ultimate result of the healthcare engagement is patient outcome. The objective is to improve the patient outcome regardless of where they present or where you have to deal with the patient. And what to do this, we try to look at the system in 4 major components. We look at access to records, which is where the EMR comes in. And then the next thing we look at is the patient engagement, which I think is what we discuss a lot when we talk about mHealth. A lot of mHealth solutions and things that we look at have to do a lot with how you engage the patient in the continuum of their care. And then we also have the clinical decision support, because if we're going to bother with reducing the cost of healthcare, then the next thing that we need to do is to be able to prevent certain things from occurring in the future so as to reduce cost. Now, we have built an electronic health record system, or hospital information system, like we like to refer to, called MedicPlus. And what MedicPlus does is that it's a federated electronic health record system that can allow health organizations that run multiple hospitals or single hospitals to run the local EMR systems that can now exchange information when network connection becomes available. This, when we're referring to the infrastructural challenges in Nigeria, you cannot depend on running an EMR that is centralized, and then when the patient presents to the doctor, you cannot access their information. So by doing so, patient can go from hospital to hospital, their information will be available, but only synchronized once the network becomes available. In that as well, we have clinical decision support, where we have standardized on ICD-10 diagnosis codes for general care, and especially ICPC2 for family medicine or general type patient engagement. And what we do with that is we look at diagnosis patterns, and based on those diagnosis patterns, generate clinical indicators that can now assist the doctor when he's seeing a patient, a diabetic patient or a hypertensive patient, to remind to do for some diabetic tests and things of that nature. And these rules can continue to be changed for healthcare practice as we learn more information from the systems that are collected. Then in addition to that, in patient engagement, because a patient has been enrolled and diagnosed with, say, diabetes, the system is able to, on a yearly basis, send out the SMS reminders to the patient, reminding them to come for their foot exam or some of those some of those preventative tests. The ultimate objective here is now to reduce emergency hospital encounters that cost a lot of money to the hospital. If you look, we have several clients in Nigeria now that we're working with, from large organizations that have upwards of 100 beds to smaller organizations that have about 10 beds. You find out that the large organizations who have an A&E section, an A&E department, tend to see a lot of patients in there, and they cannot charge a lot of money for the true cost of care there. But if we can work with the people likes of Airtel here, I learned something yesterday or today called Free Basic from, what's their name? Facebook. that allows to have free data access when even when you run out of data. This would enable a lot in patient engagement, as it can spur people to develop mobile apps that now can still have access to their patient record and things of that nature. And then the Tony Limited Foundation in the public sector, I'll tell you some of the challenges that we do face.
Don't do that. Don't even start.
I think we need to give all these young ideas and innovations around the applause. We agree with you. Things are happening beyond what we expect.
We're going back to our panelists, and would like to take the next question, which will be for Mr. Adeniji Adeli.
So the question is, which areas of healthcare do you think mobile technology can be effectively used, in addition to some of these, especially in Nigeria?
I think our determination should be to make healthcare system in Nigeria more collaborative, and that's between the primary healthcare sector and the tertiary. I see a link in there, and I think we should kind of encourage this. So I would like that list, please. Yeah, going back to your question. There's one, I see, there's this innovation called TV white space. I feel that's the next frontier in e-health. Why? I'll tell you what TV white space is. TV white space uses unused spectrum. Think of your TV station. It uses unused spectrum to transmit internet access. It's way longer than wireless. It goes through breaks, very low frequency, and it's very cheap. I feel that is the next frontier. So I'd like everyone to go and research it. If you do have any innovation that you feel will need internet access, it can reach those areas that we feel you don't have the masts, for instance, but they get TV signals. I feel that is the next area of innovation, and that is what I feel we should really work on getting. I feel really that's the next step for us to take in reaching those unreached. Thank you.
Okay, my additional comment is relates to the rural and semi-urban populace in terms of how to reach them. Basically, technology does not need to be complex because some of these populace do not have access to top-end devices. They basically have feature phones. So if you're developing, you could still look more around SMS-based solutions for that segment of the market, which is really underserved in terms of providing solutions that will improve quality of healthcare delivery. Thank you.
All right. What is the future of mobile payments in Nigeria?
Thank you. So I'm not going to be talking from an industry perspective. I'm going to be talking from what we know just makes sense. If you really look at, I'm going to take the question in two dimensions. The reason why there's not been significant mobile banking or mobile penetration really in Nigeria is because of the ability to cash in and cash out, basically, right? Now, Nigeria, most of the fund flow goes from certain urban cities to certain rural areas. No matter how many mobile money operators you have, the reason why you will not really have this adoption is because there's not just a place for these guys to actually go and get value when those things are being exchanged. Now, if you look at what happens in Kenya with M-Pesa, basically what that basically is that you can go to any one of those particular agents in rural and urban areas. And also the policy actually assisted in that becoming a reality. At least we're on different panel with CBN and different regulatory. It is highly unlikely that there will ever be a policy at any point in time that advocates some of those responsibilities to some of the mobile money operator. And in the session, I asked the question, why? And it said, basically what that inevitably means is that the funds flow will go from the financial sector to the telcos, and that will have a significant impact in that sector. Even if you look at what happens in Kenya, I was in Kenya just about 3 weeks ago, There's also still some opportunities for other things to happen, because right now they're also having issues around even the M-Pesa that everyone keeps saying this is the gold standard. So the future mobile payment is simple. I refer to it as an agent network. An agent network that is agnostic, that everybody can participate in. And that is really what will be able to address a lot of these issues that we're having here as a nation. What I mean by that, an agent network, meaning, a lot of, some of them, I won't refer to specific names, but if you look at some of the banks have mobile money license, they've tried to set up an agent network, but the issue is that they're not active agents. So invariably, they only have presence in certain geographic areas. And if you really want adoption, you need it to be nationwide. I mean, if you look at what happened in pre-2000, banks were bringing in ATMs, but there wasn't really value to the general population. Why should I use a particular bank's card at a particular bank's ATM? But the moment there was interoperability in the platform, obviously look at the significant adoption with that particular sector. So from my perspective, I'm just talking about something that is for the greater good of the environment, because we know that is where the value is to the end user. So when you have an agent network that all the telcos can play into, it will be much bigger than M-Pesa. We have a volume. We have people that are very, very technologically advanced. Because in the M-Pesa model, is only one of the, well, luckily Airtel is one of the, so basically in this environment, a platform that is agnostic and everyone can participate in. I just want to make a quick comment because I didn't have an opportunity to make a comment earlier. Even from our perspective, we looked at this sector, the health sector, like what are the things we can do in this sector to actually show value? And it's been one of the most difficult sectors as an organization to penetrate, because we just don't understand the gestation period. Decision making it takes a long time. And I think what we've narrowed it down is that you need to find a model that some of these individuals can relate to. So we have two approaches. When we engage state and federal hospitals, we give them a model whereby the bank actually pays for the solution and they recover their monies over a period of time based on transaction. But more importantly, they see a significant increase in terms of their collection or their margins, so they can actually justify that. That has actually been one of our most successful products. It's something that actually sells itself, because one of the things we now do, we have a stakeholders engagement forum, and all the CMDs, at least we have one of the top twos in the country. They speak to how this thing has been able to address the issue. But the issue from the federal and state hospital is different from the private sector. They are more concerned about fund suppression and pilferage, and that is a very systemic issue around that, to the point whereby now state governments come to us and say that any collections or activities done in this hospital, I want a centralized position so I can see all the activities. At least I can say today we're in Ogun State, we're doing for all the hospitals in Ogun State and even in Kano State, and more states are coming on to that particular. So that's the value proposition we've seen. Now for this particular private sector, we're made some significant progress, but it's still something that there's no standardization. The sector is so fragmented, so there's not really policies around ICD-9, ICD-10, what have you. And even with all the medical electronic providers, the opportunity is quite big. What we need is, we're not saying we should have one or two or three, you can have as many service providers